Still talking to the significant others of recovering people, loved ones, friends, brothers, sisters, and others. Sometimes a probation officer, a DHS worker, a police officer might be in on this as well. But anyway, we started by talking about biases people have against the medications we use, and how that interferes with the person's recovery, how that isolates them from you, and how it's counterproductive. What they need is your support, your acceptance, your encouragement. Now, unfortunately, there's a bad history. If it's your child who's stolen from you and done lied and done other bad things, then that's not something you forget very easily. And when you hear that, well, they're taking drugs from this doctor out there, and they're opiates, and they're benzos, and they're bad drugs, you're naturally going to have a response that they've just found a doctor that just goes along with all their bad habits and is not helping them. Of course, that's not the way we see it. We help them because they're getting what they need to deal with their basic problem, which we perceive as what we call a receptor disease. Receptors are things that connect one nerve cell to the other in the brain. One cell liberates some hormone, the other nerve cell picks up the hormone and it fires. And the brain's information is processed by neuron hitting the next neuron that has a receptor, and the hormone that triggers that receptor. So the whole business of the brain is receptors and neurons connecting each other through these receptor channels. Now, addictions, like a lot of things, are problems with receptor. The best known receptor disease is depression. And you've heard about serotonin, that they don't have the right amount of serotonin in the receptor, so when they should get excited about the kickoff of the football game, they don't, because there's no serotonin moving over to the other nerve cell and getting them all excited. Normal person obviously gets excited, especially if it's the Eagles. But anyway, it's a receptor disease when it's depression, and we can give antidepressants and tone up that receptor, get it firing. The person feels not as depressed anymore. Now, there's a lot of receptor diseases that we're beginning to learn about. One is fibromyalgia. A person has pain all over their body. They can take pain medications, but pain medications don't work. They feel fatigued. They've got a lot of problems all over, not in any one special place, because the receptors, the brain receptors, are related to all parts of the body, and you get the pain where that receptor isn't firing that should be firing. So you got a receptor disease in fibromyalgia. There's also evidence to think that ADHD, which is a disease they talk about most with children, is another receptor disease. They give them Ritalin, which drug addicts love. It's speed, basically. They give young children speed, basically, and their receptor disease is corrected, and they can concentrate in school. They don't jump out of line. They can do their homework. They can pick up what the teacher's saying, because their brain's now functioning normally. When without the Ritalin, their brain isn't functioning well. Now, it's interesting that children don't get addicted, even though they're giving a drug which will addict somebody who doesn't have that receptor disease. So some people take it when they don't have the disease, and they become addicts. The children that are given Ritalin don't get addicted, and they get better marks. Pay attention, they do better. It's a controversial area, but all of these receptor diseases are just emerging and being recognized as to what they are. And now we're treating a receptor disease, not just poor attention or bad behavior or feeling sad and not getting on with things despite the fact that somebody that they love died. We're thinking about, let's get the receptor fixed so that they can move forward. and addictions in our mind turns out to be one of the other receptor diseases. So thanks for listening.